Today I will be demonstrating how to perform the blood spill safety portion of the Maryland Board of Cosmetology Aesthetics Practical Examination, according to the Prometric guidelines. The procedure guidelines will also be posted at your workstation during the examination for your use. The blood spill safety portion of the exam must be performed exactly according to the guidelines. Because of the recent increase in awareness of bloodborne pathogenic diseases, any deviation from the protocol could result in an automatic failure, and you will not be able to continue with the other 3 parts of the exam. I will be going over the procedure from start to finish, including the blood spill critical supply list. This is the exact supplies you will need for this portion. We will go over how to set up and place the supplies at your workstation in order to execute the steps in an organized and timely fashion. I will show you specifically how to discard all items to avoid cross-contamination. I will demonstrate how to attend to your model. According to Prometric, candidates may bring clearly labeled products, so it's not necessary to bring big or bulky items to the examination. It's much easier to bring small items that are labeled properly. The exam proctors are not looking for name brands. They're looking for your labels to make sure that you know what you're supposed to use in your salon setting. The containers that I'm using today fit about 2 to 3 ounces of fluid, and I mark them with white address labels and Sharpie marker. These bottles are inexpensive, easy to find, and easy to label. Small, clearly labeled bottles will keep you organized. They're easier to discard and eliminate the chance of any cross-contamination, which could result in failing. Make sure your handwriting is large and clear so the exam proctor does not have to approach your workstation to read your labels. This is an example of some of the big bulky items you do not need to bring for the blood spill safety portion of the exam. They're difficult to discard of, and you won't need this much of any item at all because everything that you use for this portion of the exam will be discarded. Right here I have my large Ziploc bag labeled blood spill, and this is the entire kit that we will be using for the blood spill portion of the exam. Here I also have a paper bag for stability, and then I'm going to put a plastic bag inside for all my discarded items. This is our entire work area. First thing we're going to set up here is our sanitary maintenance area. Next, we're going to set up our sterile maintenance area. Also here I have a bag that is labeled disinfected sanitized items. We're going to set up a folded paper towel. And on top of that paper towel, we are going to place our tweezers. We're also going to place our pair of rubber gloves. We're going to go and get our antibacterial soap from the bag. Place that. We're going to take 1 gauze. Place that. Gauze pad. Next to that, we're going to place our Neosporin, which doesn't really have to be labeled because Neosporin kind of has a universal look. We're going to place 1 cotton swab. And we're going to place a bandage. And we're going to place our red bags in the sanitary maintenance area. And in our workstation, we're going to place our EPA spray, our antibacterial soap with our 1 paper towel attached. Our EPA spray also has 1 paper towel attached. And we're going to place 2 paper towels in our sanitary maintenance area as well. Another thing that we have here is our soiled implements container. And inside our soiled implements container is a bottle with our EPA broad spectrum disinfectant solution. So today what I took out of my Ziploc bag is a linen towel as my sanitary maintenance area, a cloth towel as my sterile maintenance area. First thing I put down was a paper towel. I folded a large paper towel and put my tweezers on top. And I have a pair of rubber gloves next to that. And then I have my antibacterial soap in a 2-ounce container next to my rubber gloves. I have a one single gauze pad folded next to my antibacterial soap. And then I have a single-use packet of Neosporin next to my gauze. I have 1 cotton swab next to my Neosporin, and then I have a single-use bandage next to my cotton swab. Behind that, I have my 2 folded paper towels for cleaning or washing my hands. I also have my 2 red biohazard bags that also has a self-sealable top. I also have my antibacterial soap with a paper towel wrapped around it so I can place this at the sink. I also have my EPA solution that I will be using for my soiled implements container. And I also have my EPA spray that I will be sanitizing my entire work area when I am finished the blood spill procedure. I also have here a soiled implements container. It's a small container because we will also be discarding this for my contaminated tweezers. Before my procedure, I'm going to place one of my 2 antibacterial soap with a paper towel wrapped around at the sink, at the exam site sink. Bring one of my paper towels to clean my hand and my soiled implements container. First thing I'm going to do, I'm going to fill up my soiled implements container with just enough water to immerse tweezers. Put that off to the side, put my paper towel on top. I'm going to take some soap, place it in my hand, and leave my soap there. So I'm going to sanitize my hand for 15 seconds. Take my paper towel, clean my hands. I'm going to take my soiled paper towel back to my workstation where I've set up my trash can. I'm going to take both of these over to my workstation. I'm going to leave my soap and my paper towel here for the conclusion of my exam. At this point, your setup time will be over. If you run out of time or you're not able to finish setting up, you can use some of your procedure time to finish setting up. So the first thing we're going to do is we're going to put on our gloves. You're going to spread the client's eyebrows and simulate pulling out a hair. Now at this point we have nicked the client's eyebrows. We're going to take our tweezer. We're going to place it in the paper towel that we have at our workstation. We're going to take our antibacterial soap. We're going to place it on our gauze. We're going to take that gauze and we're going to clean the area and stop the bleeding. We can also put that gauze back down at our workstation. We're going to open up our Neosporin or triple antibiotic. We're going to put a little bit onto the cotton swab. We're going to take this cotton swab and we're going to wipe outwards on the client's eyebrow. We're then going to take the bandage and we're going to place it over the client's eyebrow. And again, we put everything down at the workstation. Okay, so at this point our client is taken care of. We have stopped the bleeding. We're going to take our tweezer and our paper towel that we had placed at our workstation. We're going to take our EPA spray. We're going to spray our tweezer, clean all the excess debris and blood off. There's our paper towel. Open up our soiled implements container that has our water and EPA solution inside. Securely place the lid back on top. We're going to take one of our double red bags. We're going to place our soiled implements container into the bag. We're going to place our EPA spray off to the side here. Put our lid back on. We're going to place every single thing at our workstation into one double red bag. We can also take our blood spill kit bag, place that in as well. We're going to place this just over to the side right here. We're going to take our rubber band off, place that into the trash as well. We're going to spray our entire workstation area, spray everything down. This is also going to go into the discarded items. We will open up our towel and wipe the entire workstation. You can also hold this in our hand. Wipe the entire workstation. Place our paper towel inside. Stabilize it here. Let's put it up against here. We're going to take our gloves off. Place our gloves also inside the blood spill bag. We're going to take the white sticker off. We're going to securely seal this bag. We're going to take our second bag. Place everything into the second bag. Take the white sticker off. Seal this bag as well. This entire bag goes into the trash. At this point, we're going to go back over to the sink. We left an antibacterial soap plus a paper towel here at the sink for us to use. So we can just take that rubber band off, put a little bit of soap in our hand, wash our hands for 15 seconds. We're going to wipe our hands with our large paper towel. We're going to take our soap and our rubber band. We're going to walk back over to our trash can, and we're going to place this into our trash bag.